Medical graduates are worried about finding employment. The students who went to study medicine in Russia claim that the South African government is neglecting them. According to the students, officials had promised to pay for their exam fees, but claim they've now been left high and dry. Victor Khanyile from the National Health Department joins us now to discuss this. Mr. Khanyile, good afternoon. Welcome to Today on eNCA this hour. I'm sure you've seen these reports about this group of medical students, 38 graduates from Mpumalanga. They said they were sent to study in Russia at the Astrakhan State Medical University, and they've come back, they've completed, but they are stuck. Nothing has happened, they say. They don't even have the money to pay for the South African board exam fee, which is about 13,000 rand, among other needs. You, as a National Health Department, you must be concerned that there's a group of qualified medical students, South Africans, who are sitting idle.
A very good afternoon. Thank you for this opportunity. Indeed, I mean, as the National Department of Health, who is obviously the employer and probably the largest, I mean, as most of South African population rely on our public health service system, we wouldn't want to have any health professional who is not employed, particularly after completing their qualifications. However, we need to put the matter into context to say that the Mpumalanga provincial government is the one that is responsible to ensure that, working together with the Health Profession Council of South Africa, who is the authority to register all health professionals who qualify as medical doctors to practice in South Africa, it's helped or assisted accordingly. So we, as the Department of Health, we will definitely be engaging with the province, particularly the Provincial Department of Health, to assist where possible. However, as I've already mentioned, the responsibility lies with both the provincial department or the provincial government, as well as the Health Professions Council of South Africa, to see the matter to conclusion.
But it must be in your interest that you should try and influence a speedy resolution.
Yes, of course, as I've already mentioned, that within the prescripts of the law, we are indeed continuously in engagement with the Provincial Department of Health to assist, as well as, the Health Profession Council of South Africa, in order to make sure that the matter is seen to conclusion.
Yeah, South Africa sends students, various provinces, I guess, to study in different parts of the world. And when it comes to health professionals, we know about Cuba. Now we are hearing about Russia. From the National Health Department's perspective, don't you think there should be a level of, I'm going to use this word advisedly, centralization, that the coordination should really be from your department to make sure that when the graduates come back, you are being the ones who are driving it rather than leaving it to the provincial authorities, because seemingly the Mpumalanga department there has been failing these graduates.
Honestly, I share the same sentiments as you said, that coordination at national level is imperative and needs to be adhered to. Hence, you can see that there are certain success programs, inclusion of the Nelson Mandela Fidel Castro program between the South African government and the Republic of Cuba, where it is nationally managed and coordinated on behalf of all the 9 provinces in the country. So we indeed advocate for such collaboration at national level, because there are a number of activities that need to occur prior to the exchange of students between the provinces or even the countries. One of them is to ensure that the curriculum of that particular country it meets the requirements of our registration body, which is the Health Profession Council of South Africa. So indeed, it needs to be a tripartite alliance between the National Department of Health, the province concerned, as well as the Health Professional Council of South Africa, that ultimately it's required to register or give a license to practice to these students. It is important that we educate the nation that even on an individual basis, all sponsors, inclusion of Provincial Department of Health or individual parents and any organization needs to ensure that where they wish to take these students to, that institution or university meets the requirements as put by the Health Profession Council of South Africa, as being registerable after the person has concluded the qualification. What I can say is that on the website of HPCSA, there are institutions that are listed that meet such requirement, and we would wish that all people who want to take students outside the country ensure that they familiarize themselves with that particular list as published by the regulator. In this regard is the HPCSA in short, meaning Health Professions Council of South Africa.
Mr. Khanyile, thank you very much for your time and explaining the view from the National Department of Health, because indeed you can't have 38 qualified medical students who've graduated in Russia sitting idle at home in Mpumalanga doing nothing.